Good afternoon, everyone. On behalf of Eco India and Cyber, it is my pleasure to welcome you all to this international consultation on the illicit tobacco trade in South Asia, a significant economic and public health challenge. We are grateful to everyone present here to have you join us today. This consultation is jointly organized by the DC section of the Union, CIPOD, and Eco India, and brings together policy makers, researchers, economists, and public health practitioners from across South Asia. Your presence reflects the shared recognition that illicit tobacco trade is not only a fiscal and regulatory issue, but one that directly undermines public health, equity, and tobacco control efforts in the region. Illicit tobacco weakens taxation policies, fuels unregulated consumption, and disproportionately affects vulnerable populations. Addressing it requires cross-border learning, strong evidence, and coordinated action across sectors. Today's agenda has been designed with that intent to ground the discussion in country experiences while also identifying common challenges and practical pathways forward. We are honored to have senior leadership from the Union and distinguished experts from India, Bangladesh, Pakistan, and Nepal who will share their insights from their respective contexts. We also look forward to the learning from best practices across the Indian subcontinent and Southeast Asia, and hopefully we will have a rich discussion during the Q&A session. Thank you once again for taking the time to be a part of this important conversation. I hope today's dialogue contributes meaningfully to strengthening regional cooperation and advancing effective responses to illicit tobacco trade. With that, I now invite Dr. Rakesh Gupta, Chair TC section of the Union, to provide an overview and set the context for today's consultation. Thank
Dr.
you.
Paridhi, we can have the snapshots of all who have joined actually
Right, sir.
before that.
So group photograph before we join,
Yeah,
before we
group
start.
photograph. Yeah.
Okay. Uh, all right. So I would request everyone to please switch on your cameras and give bright white smiles so that we can have a group photograph to commemorate this occasion.
Can you
Yeah,
please
good
allow me
morning.
a few?
Yeah, good morning,
Good
Dr.
morning.
Waseem. Yeah, thank you.
Sorry, I'm a little late. Can you allow me a few minutes because I want to join with another device because the
Okay.
camera one is
You
not
can do that.
working.
You
Yes,
can do that.
yes, sir.
Thank you so much. Thank you.
We can take a one more photograph, sir,
Yeah.
once
Yes,
you
yes.
have joined. In the meantime, I would request everyone else to switch on their cameras.
But we can see Dr. Waseem actually, his photograph is there.
Yes,
So
yes, yes. So on the count of three, bright white smiles. 1, 2, 3. All right, just one more.
Mhm.
1, 2, 3. Thank you.
Thank you.
So I'll
So
just share.
you have clicked all? You have clicked all, no?
Yes, sir. Yes, sir. I've taken.
Okay.
I've taken.
Thank you.
So I will just share your presentation, sir. So I would now invite Dr. Rakesh Gupta, President and Director of Public Health at the Strategic Institute for Public Health Education and Research, to give an overview on the circuit filters, implications for health effects and the environment. So over to you. I would request everyone to please mute
स्टुडेन्टलाई
themselves.
डिस्टर्ब हुन्छ अरे इक्जामहरू नजिक नजिक आयो अरे हो
Sir, over to you.
Yeah. Am I audible? No.
Yes, sir, you're audible now.
Okay. So I'll be presenting an overview of the illicit trade in South Asia. It's a significant economic and public health challenge. It is driven by high tax differentials, porous borders, and weak enforcement. So India, Pakistan, Bangladesh, and Nepal collectively they house a massive tobacco consumer base, and they're creating a high demand market for contraband and tax evaded products. So the regional overview, I'll present that the key drivers are the high taxation on legal products, and there's a lot of variation in the pictorial health warnings on the tobacco products, and the availability of the cheap, non-compliant smokeless tobacco, that is SLT, we call it. And the prevalent products are smuggled international cigarette brands, illicit manufactured local cigarettes, and they are non-compliant to smokeless tobacco products like Zarda, Gutka, and Khani. So they are non-compliant to the pictorial health warnings also. Next, please. So India is the fourth largest illicit cigarette market globally. And market share, it is about, actually it is about, as estimated, it is about 2.73, but the tobacco industry says it is 26.1%. And the revenue loss is about 2.7 billion rupees, US dollars, in a year. This is 2025 figure. And the inflows are through Indo-Myanmar border, Bangladesh. Then smokeless tobacco, roughly 93% of smokeless tobacco, they are considered potentially illicit. Next, please. So Dr. Pritam Datta will be talking in detail about the illicit products in India. And in Pakistan, Dr. Waseem Janjua will be telling in details. It faces maximum tax in evasion, and the extent in rural areas, about 89% of the cigarette packs in rural Pakistan, they are non-compliant with the labeling laws. The smokeless tobacco, almost 100% of the smokeless tobacco products in Pakistan, they are non-compliant with the local packaging laws. But please, Dr. Wasim, please correct me if I'm wrong. And the enforcement, there are increased intelligence-led raids on illicit godowns. Next, please. So Bangladesh, Dr. Shafiun will be telling us in detail about the problem in the Bangladesh. While some reports suggest a low illicit cigarette market share, approximately 2 to 3%. The regional hotspots are there, like Molvi Bazaar. It may be as high as 13.63%. The economic impact is about US dollars 100 million annually. And smokeless tobacco, 92% of the STPs or the SLTs, they are non-compliant, especially to the health warnings. In Nepal serves as the Nepal serves as both a transit hub and a destination for illicit tobacco. Next, please. So Dr. Tara Singh Bam will be telling in detail about the problem in the Nepal. The regional inflows are there presents major international firms like Japan Tobacco International JPT. They operate in Nepal. Then countermeasures are the 20 as per 2025 updates. The track and trace in May 2025, the Indian government that moved towards rolling and pack level track and trace mechanism to modernize regulatory enforcement, and intensified raids has been there because by the Director General of GST and Director Revenue Intelligence, that is the Custom Department of India, and the Federal Bureau of Revenue, uh, that is FBR in Pakistan. So over to Dr. Pritam Datta for the details in India. Yeah.
Thank you, sir. I would now like to invite Dr. Pritam Datta, who is a fellow at the National Institute of Public Finance and Policy, to give his talk on the illicit tobacco trade in India as a significant public health and economic challenge. So, over to you.
Thank you.
I've given you the access as well, sir.
Thank you, organizer, for bringing me here to present my findings or observation regarding the illicit trade in India and the context of India. Globally, we know that cross-border illicit tobacco trade result in loss of around 40.5 billion in revenue in terms of US dollar. And eliminating it in low and middle income countries could recover around 18.3 US dollar, 18.3 million US dollar in revenue. Indian tobacco industry cites the Euromonitor report to claim that 25% of the cigarette market was illicit in 2019. However, independent researcher estimated illicit cigarette use at 5.6 in 2019 and roughly 6% in 2016-17, with only 3% smokeless tobacco products found to be illicit in this country. So the two finding 2009 10 to 16 17, it's only 5.6% to 6%, 5.6% to 6% as a percentage growth. India is clearly losing revenue due to the illicit tobacco trade. There is no ambiguity about this statement. But can this be a reason for lowering taxation in our country? So it is important to note that the country has a large informal tobacco manufacturing sector within the domain of the country, as well as numerous informal vendors, and is a home of low-price tobacco products. So illicit cigarettes are more prevalent in, and we all know that recent studies we did at NIPFP, we found that illicit cigarettes are more prevalent in Indian cities such as Jaipur, Delhi, Kolkata. So rural areas are not suffering that much because of our illicit trade, but their use of product from the produced from the informal sector are more prevalent in the rural India. The most popular and non-compliant brands of cigarette are Ease, that's manufactured in South Korea, and Black in Indonesia, that we found in our recent survey conducted by NIPFP. So it is not a clear cross-border smuggling. The popular brands are coming either from South Asia, South Korea, or Indonesia. Now, country to industry claims extensive evidence from global health organization as well as independent study shows that increasing tobacco taxation doesn't lead to a rise in illicit trade in a country. Evidence from independent and peer-reviewed studies across many countries, including UK, Philippines, Brazil, and Vietnam, shows that the illicit trade has generally remained stable or has even declined despite substantial increase in tobacco taxes. For example, in the UK, for cigarette prices rose more than double between 2000 to 2014. During the same period, both smoking prevalence and illicit trade declined. So there is not a direct relation between uh, rise in tobacco taxation and the illicit trade. The rise in cross-border illicit trade, despite stable or increasing formal imports, are found in India, imports and exports, and domestic production we found in India. It suggests clearly that smuggled products are not replacing the legal ones, but are being added alongside with them. This clearly indicates the illicit trade represents a leakage rather than a substitution, pointing to gaps in enforcement and weak regulatory control in our country. Research indicates that profit maximizing smuggler typically increase the price of illicit cigarettes in line with increase in legal cigarette price, and which still discourage consumption. The primary drivers of illicit trade are, as identified by many independent researcher and also we found in our own research, that is the weak tax administration, lack of effective customs control, and as well as the corruption. The World Bank and World Health Organization (WHO) emphasizes that strengthening enforcement and governance are the most effective ways to combat smuggling or illicit trade. The WHO framework of Convention of Tobacco Control, that is FCTC protocol to eliminate illicit trade in tobacco products, provides a global framework for countries to implement control measures such as tracing and tracking system to combat illicit trade effectively across countries. Cross-border illicit tobacco trade should be viewed as a general leakage in the transborder movement of products. I mean all products, irrespective of tobacco products, and must not be used as a reason to undermine India's tobacco control effort. It is essential, yes, it is essential to strengthen border security to prevent the illicit movement of all goods, including tobacco products. Alongside, I like to conclude with the saying that India must stay committed to increasing tobacco taxes in line with WHO recommendation to effectively raise price and curb consumption. So, for my understanding, as per my understanding, there is no relation between illicit tobacco trade, no rivalry between the illicit tobacco trade in our country and rise in tobacco taxation that very recently happened with the GST revision. And India should committed to increase tobacco taxes in our country to control or buckle the tobacco consumption in our country. And it's a matter of customs failure when it is when we are talking about illicit trade, and there is no rivalry between illicit tobacco trade in our country and our efforts to increase taxation of the tobacco products. Thank you.
So thank you, Dr. Pritam. And your observations are quite good. You said that $80.3 million losses because of the illicit trade in South Asia, in the South Asian countries. Am I right? And you
Yes.
said that you also told about the most important brands, which are,
These
cross-border.
are black.
Yeah, black and what else?
Black
South Korean brands. What was the South Korean brand?
is
Okay. So the illicit trade stands still or even declined in many countries actually, and there's no relation with increased taxes and illicit trade. And we need to increase the taxes as per the FCTC guidelines. So that is important, and we need to curb the consumption of the tobacco drugs by quitting tobacco, so making people quit tobacco. So thanks a lot. So we'll come back to you with the draft recommendations, especially for India, and so you can just give your comments on that. Yeah. Thank you.
Thank you, sir, for your talk. I would now like to invite Dr. Shafiun, Professor and Director, Institute of Health Economics from University of Dhaka, to give his talk on the tobacco trade in Bangladesh as a significant and economic and public health challenge. So over to you.
Thank you. Can I share my slide?
Yes, sir. I've given you the access.
You can see the slide now.
Yes, I can. If you can please go full presentation mode.
Now it's good.
Yes, sir. Yes, sir. Thank you.
Thank you. So thank you so much for inviting me. Bangladesh, India, Pakistan, and the South Asian countries, we have kind of similar situation, and the policy is also very much similar. So I'll not repeat what's already been covered, already been told. I'll just mention very much Bangladesh context part. So we know that the Bangladesh is high prevalent of tobacco. It's there around 35% adult use tobacco, and cigarette consumption has actually increased since our last GATS, which is I think 2009 to 17, and smokeless tobacco remain kind of stagnant, and that's why there's high vulnerability among youths and low-income people. And Bangladesh issue is a little bit different compared to other South Asian countries. Is It's not that our tax rate is good, but the price is not that high. So it's more of, WHO recommended 75% tax rate, but ours is 83, which is way above WHO recommendations. The problem is price is so low, the base is too low. Even with 83% is still very low. So this context, we have recently conducted a study where we found that Bangladesh economy lost 87,000 crore per year, Bangladeshi taka, for tobacco related disease and environmental cost. And in the same year, NBR actually collected revenue of around 40,000. So the economic loss to the is much higher than the revenues being collected. So it's kind of a little bit context if you have. And also the secret tax facts, if you kind of, Bangladesh has a high multi-tiered system like Pakistan, but recently they changed it. And we had kind of different tax rate across tiers, but now since 2024 or end of 2024, we have revised it and it's now same 67% supplementary duty now. And all together, like VAT is 15% plus 1% health development surcharge, it becomes 83%. And mostly the biggest market share is the low and medium tier cigarettes. So even though you have a 4-tier cigarette, last 2 tiers capture most of the market. Now, we had actually a research report based on, it's called tax gap analysis. I'm sure many of you are familiar with the tools. Using that, we estimated illicit trade percentage prevalence across South Asian countries. Probably it could be a good reference for others. It's mostly based on literature, but we also re-estimated illicit trade based on the data we have, the consumption and the revenue, and if the tax gap is a kind of the illicit. So this is one of the quickest way to estimate an illicit proportion in a country. And this study, this is the kind of key findings for South Asian countries. And if you look at Bangladesh, has not, like, depending on the study, you'll see that it kind of tells it's not incredibly high. Whereas probably Sri Lanka, we kind of see high. But again, it is sort of summary of the data we have from the tax gap analysis. So it could be that tax being collected, whether it's underreported, all those stuff can affect this estimation. Now, if you look at the extent of illicit tobacco trade, in most cases, very interesting for Bangladesh, you'll have 13%, a study found, and a two other study, which is independent study, they found 5.6%. And the World Bank study in 2019, they found 1.8%. So there is a huge difference between the findings and depending on who is doing this study. And very interestingly, when this tobacco industry funded research, they found highest, which is not surprising, and they estimated 13%. And then the company who this study, they even did not, fully declare that it's funded by tobacco industries. So you can see that motivation behind doing this study. And estimated revenue loss, according to that tobacco industry study, it is huge, but when our independent research and the World Bank research says it is not that big, the way they're highlighting. So it's clearly the narrative tobacco industry put forward in Bangladesh is that illicit part is very high. But if you look into the other country, like other studies, which is more of independent, we don't see that level of high level of illicit trade. Even our study, which we use a different method, like tax gap method, compared to these two other study I'm mentioning here, our study did not even find that it's less around 5%, which is very close to what a few other study found. So except that the tobacco industry funded project, all of the study are showing that illicit trade is not a big number in Bangladesh. So this is the economic part. The public health part we know is very much common to India and Pakistan, other country, but we have a huge informal sector, not in cigarette, but in biris, the low price cigarettes into that. And there is no to minimum effect in consumption. That is why from from the GATS 2009 to 2017, we have said there's an increase in cigarette consumption and higher burden of disease because of this high consumption. So public health is a big concern because we are not increasing the price the way it should have. Compared to other country, we already said that Bangladesh has a very high tax. The key is since the base is too low, even if the high tax, it's not a significant number because even if you compare with inflation and then economic growth, actually the affordability has increased over time in last around like decades. So for due to this not enough increase in the prices. And we have yet to establish track and trace system. We have a weak enforcement, which were common. And this is another part is interesting. TI's influence is huge in Bangladesh. In fact, many of the board of the directors in British American Tobacco Company is the government officials, sitting government officials. They are not the retired; they are the sitting government officials. So there's a pure conflict of interest here, and that's why very difficult to implement something against tobacco industry. But fortunately, we actually revised our anti-tobacco law in just 2 weeks ago. I think that is a big accomplishment of the anti-tobacco campaign people. So the biggest challenge is we have an informal production network, especially berries and other low price products, and a limited or no track and trace system. Government is actually preparing for this, but yet to establish. Border informants, especially in the Myanmar areas, that kind of little bit tension in terms of illicit trade. Good thing is, I would say, that most of the cases, our borders across the road, the price is even higher. So we don't expect much illicit trade in our country. It's not, things are not coming. Probably it may go from Bangladesh because, price is cheaper, way cheaper in Bangladesh. So that's why these are kind of few challenges. It's still low, but other challenges remain. Fragmented monitoring. Our monitoring NBR, mostly the person or group who are, but they're not enough resourced. So the policy option we can do in Bangladesh, probably we definitely have an effective the trace and trace system we can introduce. And tax administration, we have to focus more on pricing so that tobacco industry cannot charge a price below certain level. And I already Pritam das said that increasing price has no strong correlation with illicit trading across in other countries. And even in Bangladesh, last few years, government has raised the price, not though like expected, but still we don't see that if you compare to the previous study, there is no increase in illicit trade. So that's kind of people can also participate in increasing awareness. In many countries do barcode system. You can look at from the app and then easily can help government to figure out illicit. So all these things, options are there in place. We can enforce. So broadly speaking, illicit tobacco trade is in place in Bangladesh, but it's nothing worrisome. It's very small. But we should not wait that illicit trade will increase. That's why we should not wait to will not increase tax. In fact, it's high time we should increase tax and also the price so that it become less affordable and it's to get a public health benefit. So thank you so much for your patient hearing. Thank you.
Thank you, Dr. Shafiun. You told us that the taxes, they're quite high in Bangladesh. It is as high as 83% on the tobacco products. And
Right.
as per your study, it is the illicit trade is even less than 5%. But
Right.
tobacco industry always says that illicit trade is too high.
Right.
And so track and trace system, they are yet to be placed. And as with all other countries, the enforcement is always weak, and tobacco industry influence is always there uh, in the illicit trade. And the policy options, you also enumerated the policy options. So we'll be sharing the recommendations with you, and then you can just let us know if any corrections are required. We actually aim at India, the officials in India, for this for sending them the recommendation here. Thank you. Thanks a lot.
Thank you so much. Thank you. Thank you.
Thank you, sir, for sharing your expertise knowledge on this. I would now like to invite Dr. Waseem. Just give me a second, Dr. Waseem Janjua, who is the consultant at the Sustainable Development Policy Institute, to talk about this challenge in Pakistan. Sir, over to you. So, can I help you with the sharing thing? I've given you the access.
Okay, yeah, thank you. I think I got the access. Let me just start the slides. Can you see the slides?
Yeah, we can see the slides.
Thank you. Okay, so first of all, I do not have any conflict of interest. SDPI, my organization, does not accept funding from the tobacco industry and organizations affiliated with the tobacco industry and other commercial organizations whose interests are not aligned with improved public health. And for my work in tobacco control, I regularly receive funding from from Bloomberg Philanthropies, grants by Vital Strategies. Just an acknowledgement that I am truly and thankfully acknowledge studies conducted on illicit tobacco control in Pakistan by WHO Islamabad office, Social Policy and Development Center, that is SPDC in Karachi, Federal Board of Revenue, and University of Bath Tobacco Tactics, and other local and global tobacco control partners and advocates. I acknowledge using their findings and conclusions for this presentation. Very interesting, as I was listening to other the speakers also from Bangladesh and India. So the tobacco industry in Pakistan claims that it's 60% of the total trade is illicit, and another study shows 74%. Our researches or the researches by the tobacco control advocates like SPDC and our own organization, WHO, etc., they show a maximum of 35%. So a couple of years ago, SPDC also did a study and they were at 32%. And I mean, this is a reasonable figure in which where we stand today. I fully understand that this is very high as compared to 5% in Bangladesh, but that's how the situation is. And out of these, there are 12% which are smuggled. Rest, all of them are locally produced, and they are being sold as illicit. They don't have a graphic health warning, or they are being sold under the mandated price, or they are being sold without the tax stamps. So FBR actually they did some stringent enforcement, and I'm going to talk about it in the subsequent portion of my presentation. The compliance of the track and trace system that rose from 48% to 57% within a couple of years. 60 to 70% of the tobacco on the global illicit market are manufactured legally by the big tobacco, and they basically, the illicits or illegal, they constitute three kind of products all over the world, and as well as in Pakistan. One are the contraband, which are moving goods across borders illegally to avoid taxes. Illicit whites, these are legally produced brands destined specifically for illegal distribution in other markets. So many of the tobacco industries producing products, they are smuggled outside the country as well. Then there is an oversupply within own market, and that actually causes the illicit prevalence to go up. So why do they actually smuggle these products, or why do they actually produce illicit? So basically, it's very simple. All of it is about profit. Tobacco companies have managed to shift the illicit tobacco issue from a public relations disaster to a public relations success story, in which they are the victim. That is the finding of the University of Bath. And they say that they overproduce, they sell it in markets, and then they use the same money for lobbying and for other activities which are not aligned with the best tobacco control practices. The mechanics of diversion is very simple. It's produced and it goes to transits, and from transit, when it gets diverted, into some of them are transported inside and sold as black market, and others are exported through the porous borders. And Pakistan is blessed with multiple porous borders all around us, so we are heavily smuggling out, as well as almost 12% of our own market is the smuggled cigarettes from abroad. The straight and simple impact is twofold. One is that it causes a huge loss to the national exchequer, illicit trade, and then at the same time it's hurting the public health, because availability of the cheap products that basically puts a direct burden on the health. And our calculations have shown that there are almost 160,000 annual deaths in Pakistan directly attributable to tobacco use. And Pakistani, almost 1100 billion is the economic loss because of the health burden because of tobacco, out of which almost 300 billion or less than 300 billion is paid by the tobacco industry as taxes, and rest almost 3 or 4 times is borne by the government, which is a huge gap. One of the studies that we conducted in Pakistan, and we noticed a pattern by tobacco industry. So every year, like in November or December or January, the industry starts funding these kind of frivolous studies which claim that Pakistan is losing 300 billion rupees to the illicit trade. And interestingly, for the past 2 years, we noticed that this 300 billion rupees figure has stuck with the industry also. With their every study is finding 300 billion. I don't know how can they do that, whereas their total taxes they are paying are less than 300 billion. But anyway, they create a hype before the budget, and they say that we are paying very high taxes, whereas smuggled and illicit are not paying any taxes. And they threaten that if you increase the revenue, they threaten the government. If you increase the revenue, if you increase the taxes, the revenues are going to fall. And the result is that there is a policy stall, and no taxes have been imposed since 2023 in Pakistan. And all of us are very well aware that when no additional taxes are imposed, affordability becomes very easy, and people start and continue to smoke. Illicit trade market, this was a study done by SPDC, one of our partners here in Pakistan, and they found that only 12% are 25.9% are unregistered smuggled, and 74.1% are registered brand which are registered in Pakistan, but basically they are illicit. Another aspect that I want to highlight is that total, crop production in Pakistan has remained same for the past almost 1 decade. That's around 60 million kgs or plus and minus there. Initially, in 2016, 17, 18, the tobacco industry used to produce almost 60 or 70 billion cigarette sticks every year. But with the passage of time, they started reducing this figure. And now, as per 2025 figures, the industry claimed that they only produce 39 billion, which means that less than 50%. So the mystery here is that if the crop is the same, which is almost 60 million kgs, what is happening to the unreported brand or unreported cigarettes or unreported tobacco? How is it being processed? So that is where the industry is playing smart. They basically manufacture it and they flood the market without the tax stamps. However, in 2022, Pakistan actually imposed tobacco track and trace system, and ever since July of 2022, we imposed this, and ever since then, the compliance has gone up from 48% to 57%. Of course, they also claim, and they put this thing through the ears of the Prime Minister as well, that tobacco industry, there are two big tobacco industries here in Pakistan. There is Philip Morris and British American Tobacco, and both of them claim that they are paying 98% of the total taxes, and rest of almost 28 companies which are local domestic companies in Pakistan, they are paying only 2%. And that's why the taxes should not be increased. Basically, the focus should be on curbing the illicit in the market. So finally, probably their prayers were heard, and there is this component or a section of Federal Board of Revenue, which is known as IREN, which is Internal Revenue Enforcement Network. And they did a phenomenal job in November and December of 2025. Basically, they did, in three phases. In phase one, they actually cracked down on the raw materials and then on manufacturing. And in the third phase, they cracked down on the production. And you'll be surprised to know that in 10 days search, they actually seized more than 8 million sticks, which were more than 303 million Pakistani rupees. And as just to give you a broad comparison, in entire year 2022-23, almost 33 million sticks were seized, whereas in these 10 days blitz, only 8.1 million sticks were seized, which is a commendable job done by IREN here. And like I said, that in first phase, they actually started intercepting the logistics. We have porous border with Iran and Afghanistan. So, these two consignments worth 102 million and 9.6 million, they were, intercepted by the FBR officials. An interesting case came up when two rice mills were actually raided by the Federal Board of Revenue, and they found acetate tow. Actually, in 2024, Pakistan increased the tax on acetate tow to 44,000 rupees per kg, per kilogram, which was almost I don't know, thousands of percent higher than what it was being purchased by the tobacco industry. So they actually hid these in the rice mill, and then the rice mills were raided too in Lahore and in Sialkot area. And 12.5 metric tons of acetate tow and 120 metric ton of packaging material was actually seized by FBR within this latest crackdown. A total of 1.1 billion rupees they were actually recovered, or they were in last phase. They actually targeted something very, very interesting, that there were in a residential compound, there was a factory set up, and that factory was churning out cigarettes, and that was the residence of a very, very high government official. This is also worth mentioning, that tobacco industry, domestic as well as international, so they are busy left and right, producing illicits here in Pakistan. Yet another, crackdown on one of the Universal Tobacco Company, basically. Their brands Cafe and Ranger, that's what they were producing. And they were producing in, if the FBR officials went there in the daytime, they were shown a particular arrangement or a particular setup which was tax compliant. Whereas in the night, they were using other machinery, and they were producing illicits, and they were producing 6,000 to 7,000 kilogram tobacco was being processed per day. That is almost 45 million rupees per day. And this facility was also raided, and they were taken to task. And FBR has done, they also added Pakistan Rangers and Army along with their operations. They actually strengthened their regulatory and track and trace system was also, strengthened through their effort. Just my final concluding, you can call it a verdict, is that like any other country, low and middle income country, Pakistan government should also ignore the pre-budget scare tactics, which is created every year by tobacco industry. And you'll be surprised to know that day before yesterday, their first of the year article that came out, which pointed to illicit tobacco, and that was sponsored by, because we know which all organizations are actually working for tobacco industry. So they produced their first study, and I'm looking forward to many more from them also. But of course, we are also tobacco control advocates are also busy. And again, this tobacco taxation or tobacco taxation, the illicit or smuggled, they are not a taxation issue. They are an administrative or enforcement issue, and all of us need to look at this accordingly. And I thank you so very much for your patient hearing. Thank you.
Thank you, Dr. Waseem, Janjua. We have been working together in many consultations. We have participated together for new emerging nicotine tobacco products also. And it is actually a surprise for me that you are so much interested in illicit tobacco products also. And the claim was by the tobacco industry in Pakistan. They said it is about 60% is illicit trade. And as per SPDC, it is only 35%.
That's right.
Yeah. And the illicit, the smuggler is often the manufacturer. So that is a good statement to make, that 60 to 70% of cigarettes on the global illicit market, they are manufactured legally by the big tobacco products just because of for profit maximization. So that is what he said. Then the mechanism of diversion, he told that how the black market sold tax-free manufacturer claims ignorance. So, and diversion tactics are there, intermingling legal and illegal stock, the buffer zone. And he also gave his recommendations that we must ignore the pre-budget scare tactics of the tobacco industry, maintain tax rates in to curb consumption, and enforce the law to the ground. I think that is common to all the South Asian countries, or in fact, all the low and middle income countries. So thanks a lot, Dr. Janjua. So we'll be sharing the recommendations with you for your inputs. Yeah, thank you.
Thank you, sir, for giving your talk. I would now like to invite Dr. Singh, who is the Vice Chair for Tobacco Control Section at the Union, to talk about this challenge in Nepal. So, over to you.
Thank you. Let me share my slides quickly.
Yes, sir.
Yes, it's good. Yeah, thank you. Thank you for inviting me for this very important meeting in tobacco control. So actually, in this I don't have a very sophisticated the very science-based slides. That's I prepared some the slide based on our local experience working in the Timor-Leste. So here I'm going to highlight some of the things that we have observed in Timor-Leste. I'm sure you all know that Timor-Leste is one of the small country in Southeast Asia. It's quite near to the Indonesia and also Australia as well. Just to say, I think as earlier, all the presenters, they have already highlighted the issue of the illicit trade. Of course, it's cost the governments a lot in terms of the revenues from the different types of imported, the tax duties or the excise, all those things. So in Timor-Leste context, the recent reports that developed by some of our local, the civil society organization that presents the U.S. Almost the governments of Timor-Leste, the loss about $5 million each year because of the tobacco illicit in Timor-Leste. For a country like almost 1.4 million population there, it's a very, as I mentioned, it's very small in Southeast Asia. So the cost is $5 million is quite huge for them. So in terms of the public health burden, of course, when we talk about the smoking prevalence, the tobacco use, because of the the illicit trade, the tobacco, the products are quite cheap in Timor-Leste. You can see that as a result, more than the 40% of the boys and more than 20% of girls, they use any type of tobacco products. That's actually the huge and unacceptable figures in terms of smoking prevalence among the youth. In terms of the regulatory burden, we don't have a very concrete data in terms of the what's percentage of the the illicit the market in Timor-Leste context, but the some of the very high level the study presents like okay there are some 70 almost 20 the brands illegal tobacco products. It's actually quite prevalent in Timor-Leste context, and also when we go in any of the the shop or any of the retailers, we see the majority of the tobacco products are actually the illicit. So this is something that we have in last year in April. So we had some the meeting, and then we just visited some of the places there, like in beach or in some shopping centers, in a mall or some cafe or some the tourist attraction or the venues. What we have found, these are some pictures that I have, taken myself. So see the youth, on the top left side, you can see the youth are selling all illicit cigarettes openly. So it's in a tourist venues. So and also in Timor-Leste, especially in Delhi, in Timor-Leste, there there is some like more people visit around the sea at the evening time to have the coffee or snacks or the things. At the same time, we can see number of the youth selling the illicit the tobacco products also there. So it is something very big, the concern in public health, especially in Timor-Leste and also for all of us as well. And most of these products are smuggled from Indonesia, almost 99%. And they are manufactured in Indonesia and they smuggled in Timor-Leste markets. So when we discuss with the Ministry of Health and some other governments organizations, including the Ministry of Finance and also with the local civil society, what we have identified 4 main reasons of the illicit trade in Indonesia. Of course, one is in Timor-Leste, weak border controls. There is no such a strong mechanism, to control to check and control at the border area, whether it's airport or also the seaport. The Ministry of Finance officials, they have also highlighted that they have very limited the capacity to do this because they don't have sufficient the resources in terms of both the humans and also the financial resources as well to do the regular the check or enforcement. And then there is a very strong informal market demand. Of course, because the government is not doing enough, not enforcing the tobacco control the programs strongly. So all the street vendors, even the traditional market, very small, so coffee, so everyone, even the people, they just sell the the smuggled cigarettes, and then of course the people, there is a demand. People don't buy. So it's a very interesting. In front of the mall, of course, they are in the mall. They have their also outlet to sell the tobacco. But outside, at the gate and main entrance, we could see more than 10 young gentlemen. They're selling the cigarette. So people don't buy actually the legal product. They just buy outside the cheaper cigarettes with the same brand. So that is something. It's very, very visible. So everybody can see there. So that again, that's one of the key constraints is the lack of government's the action to monitor or to control the illicit trade there. Of course, there is when we talk to these people, actually youth and others, and then they don't know about these things. Whether there is whether this is illegal to sell these type of products. They have no idea. They say, oh, they are doing, their father is doing, their friends are doing, their other neighbors are doing. That's what they are doing also. therefore, there is very low the awareness both among the sellers and also the consumers as well. So how can we address this? Of course, the government's accountability is one of the key things that we would like to highlight. So completely, this is something happening. If we see this type of things happening in any of the country, that means it's a complete government failures in terms of the enforcement and the implementation of the strong tobacco control program. So from some of the stakeholder consultation and also with the meeting with the different advocates there, what we have come up with the key recommendation that of course they have to strengthen the borders enforcement, and they need to have a really simplify their implementing regulations. There must be a really good coordination and collaboration between the Indonesian authorities, and also there should be a sharing of information. Because what is happening in Timor-Leste, I don't think the government is really providing all the information to the Indonesian authorities. There should be a really strong coordination, collaboration, and communication, including sharing the information. And one of the recommendation to them, they need to also, of course, sign or ratify the FCTC protocol on illicit trade. Also, that would really help to build the government's accountability there and strengthen the legal and technical capacity as well. So this is something that after in just last year we did two big consultation meetings, one with the national governments, another with the local governments. The left bottom picture that shows the consultation meeting with all relevant ministries at national level in Delhi, that also engaging the WHO, FCTC, the Secretariat, and all the Ministry of Health, like all the international partners and the local partners as well. It was really great, the consultation. So that from there we have the outline some of the key recommendations as well. In the right upper part is the meeting with the local governments, with the mayors from the 14 cities, again discuss about the overall tobacco control, and also the one of the component of the discussion was to really build the awareness, build their capacity, and also engage them how to monitor, how to control all this illicit trade in their own local levels. I think that is something that we have started something to address this issue, but it's not enough. I think there is a need to have more, the collaborative approach both from the locals and national governments, including the international partners as well. I think I stop here. Thank you. Over to you.
Thank you, Dr. Tara Singh Bam, and you shared your experience with a small country, Timor-Leste, and it is a small Southeast Asian country. And you shared with us the economic burden. It is as high as $5 million per year. And the public health burden, then you shared the regulatory burden. And you also told us about the weak border controls are there, then limited enforcement capacity is there, and informal market demand is there, and low awareness about the illicit trade is there. I think this problem is common with all the Southeast Asian countries. And you also suggested some countermeasures and increasing the government accountability, strengthening the border and enforcement, improving regulatory implementation, increasing awareness, fiscal and policy tools. So thanks a lot, Dr. Bam, and we'll be sharing with you also the recommendations, the draft recommendations for your input. Thank you.
Thank you, Dr. Rakesh.
Thank you, sir. I would just like to take a minute to also acknowledge the presence of Dr. Manjeet, who's an eminent educationist, and Dr. Rakesh Gupta, sir, from Jaipur. Very a warm welcome to both of you.
Dr. Ramesh Gandhi is also with us.
Dr. Ramesh Gandhi, sir, welcome.
From Gujarat.
Yeah. So moving forward with our presentations, I would now like to invite Dr. Ravinder Kumar, who's the State Nodal Officer under the Tobacco Control, Department in National Health Mission Himachal Pradesh to share the best practices in Himachal Pradesh. So over to you.
Dr. Ravinder, can you just skip some of the slides because we are actually behind the schedule?
Sure. I will definitely do that, sir. So let me share my slide first. Sir, is my slide visible to all, sir?
Yeah. These are visible.
Right. Good afternoon, everyone, and thank you very much, the organizer, for providing me this opportunity.
Sir,
Since I'm the
apologies.
last speaker and many of
Sir, sorry. Sir,
sorry.
I can see some blocks on your screen. Is the slides visible to all of you, or is it just me?
Yeah, the blocks are there.
Yeah. So can you just stop
Can you just?
sharing? Yeah,
Yeah,
it's
there.
if you can just stop sharing and then share your screen again.
Okay.
Yeah.
Just please give me a minute.
Yeah.
Is it visible now?
So just a second.
The slides are not yet. The block is still there. But is it visible to you?
No, it is visible to me. Yes.
I think he can carry on. Yeah, I think he can carry on. Yeah.
No, please confirm from your side, sir. Is it visible?
Sir, I think you must be seeing the participants and everyone. So if you can just minimize that, then
Okay.
Yeah.
Now fine.
Yes, sir.
Yeah, it is.
Okay. So I'm tasked to have my presentation on best practices in Himachal Pradesh. Sir, it's Himachal Pradesh is a state in India having 12 districts, and as per GATS in Himachal Pradesh, 16.1% people of the age of more than 15 year they are tobacco user, and this has been discussed. So illicit cigarette trade means contraband and counterfeit. So contraband real cigarettes illegal movement, counterfeit fake cigarettes illegal production. In 2025 only, in different cities of India, very popular brand Gold Flake, its counterfeit products has been seized in India. So that means there is a big problem in India as well. This has been discussed because how this illicit trade it undermines public health efforts and also it dents our revenue. This is known to all. I'm just keeping one line that this illicit trade it is regulated under Article 15 of the WHO FCTC, and there are three articles 15, 16, and 17 control illicit trade in tobacco products. As far as our country is concerned, we regulate this through our Act COTPA. And for this illicit trade, there are sections 7, 8, and 9 where health warnings on tobacco packs are there. Section 7 says that no tobacco products can be made, sold, imported without prescribed health warning and nicotine tar details on pack. 8 says that this warning must be clear, bold, prominent, and contrasting in color. And 9 says that warning must appear in the same language. Now, there are rules 2008 where specified health warning has been notified central government. Warning display must cover 85% of the pack. Why I'm saying so? Because whenever we look for the illicit cigarettes and tobacco products in our country, if there are the pack warnings are not there, so on prima facie, it is basically illicit trade. So I can show this in the following slides through a pictorial representation. And this pack must show product name, manufacturer, origin, quantity, and date of manufacturer. So these are the specified health warning which are applicable with effect from 1st June 2025 in India, and it must have to 85% of the principal display area on the tobacco products. There are authorized officers for implementation of this, and if there is a violation, so there is a provision of punishment as well for manufacturer and for the distributor and also for the retail person who is involved in the tobacco trade. How to identify the illicit trades? I mean, we have identified illicit cigarettes in our states. So the points are that these illicit cigarettes they may have one or more of the following: no pictorial warnings, foreign language, poor detailing on cigarettes, no tax stamps or security marks, unlisted importer or manufacturer, unregistered brands, unusual taste as per the user's feedback, and very cheap price. This pic is taken by me in 2013. Sorry, it is 2023, but I took this picture way back in 2013 when I was working with Dr. Rana Singh in Union Southeast Asia office, New Delhi. And these products were found in state of Himachal Pradesh. So Davidoff is Swiss brand, Kukri is Nepali brand, Ruli River is Myanmar brand, and this Gudang Garam it is Indonesian brands. So all porous boundaries makes their easy entry into Indian states. So not only this, I mean, it's not only that the counterfeit are there, but there may be possibility that many tobacco products they enter in India as a duty paid and they are branded, of course, but even then they are still illicit if imported for sale or distribution without Section 7 compliance as per Indian Act 2008 rule and Kotpa Act, found in retail trade without Indian warnings, found in warehouse godowns, vehicle shops meant for sale under Kotpa in India. The illegality arises due to non-compliance with Section 7, not because of custom evasion alone. So it is both way. Now, I mean, when I'm tasked to share my best practices in state of Himachal Pradesh, right now we are in 2026, but exactly 1 decade back in one of the district Mandi in Himachal Pradesh, there the food safety officer, he raided some shops where he found that these international brands smuggled illegal without pack warning, More brand, SA brand, Black, Ruli River, they were found there. As per Section 7, action was taken and it was produced in the court of the law. And it was the one of the first conviction in the country where punishment was, I mean, the case was won by the enforcement organization and punishment was there, imprisonment as well as the financial, these punishment was also done way back in 2013. Now in 2025, state government, they re-notified the state, district and block flying squads. In state of Himachal Pradesh, there are 3 levels of flying squads, where the officials from 6 key departments are there. And uh, this year, because there was tobacco-free youth campaign in India for 60 days, so on 12th November 2025, in one of the cities, Sundarnagar in district Mandi in Himachal Pradesh, the district flying squad raids few of the establishments and found these brands. This is SC is Korean brand, I think. Yes, Korean brand and Mond brands and many other brands they were found. And this case was put in the court of the law. In same district, in another site where the distinct flying squads again raided some of the shops where this Philips blunt, it is a US cigar, and this Mond and the black cigarettes, they all 7, 8 brands were found. Again, illicit cigarettes and without any pectoral warning, they were found, and the district flying squad took the action, and finally they again were put in the court of the law. Since I'm the in charge of state flying squad for the state of Himachal Pradesh, so my flying squad, we also raided some of the touristy spots for 7, 8 days in 3 or 4 districts, where in many shops I found this illicit international brands without any pack warning. And because in my team there were the officers from the excise department as well, so there is so no so in excise also there is no clearance in that. So as a flying squad, I took the action, and all these cases they are put in the court of the law. It is still under trial, and the excise officers they are doing action based on their the GST Act. So convergence with other departments, that there is a excise and taxation department, police department, FDA department, they are also taking action as per their laws. As per health, we are taking action against using the COTPA provision. So what are the issues and challenges? This is my second last challenge. There are porous borders and which is making an easy entry to the state. We are sharing boundary with Tibet part of China. We are sharing boundary with Uttarakhand, and Uttarakhand is having porous boundary with Nepal. So it is rightly said by one of the previous speaker that Nepal is also a final destination for the consumers, as well as it's a transient country also. So many tobacco products are being coming to the country from that area, and it is user preference also. It is cheaper to them. I asked many shops where this SA cigarette they give at in Indian rupees 150, 160, 180, or even 220. So because they are not taxed, so they are giving at any cost basically, and it's cheaper to the this thing. And there is strong profit incentive to the trader because there are no invoices, no traceability, and they are having low perceived risk of serious punishment because the punishment is not that serious as per court as well, and the enforcement is not informed at all. One state is good informants, another are having less, and so as a result, and this Kotpa is regulatory. It is not a dedicated anti-smuggling law, so not a very serious punishment is there, and there is a fragmented jurisdiction. There is not a single agency. Interstate coordination, there is a lack, and I must say there is these smuggled cigarettes, they very easily mix with the legal stock because there is no national track and trace system there in our country, as there is in many countries where there is a stamp and each and every points, all the packets they are being traced. So possible solutions from what I have learned from my state in the past few years. Uh, we know that there are porous borders and weak upstream control because customs and DRI they have to take the action, but we can at least we focus to retail level enforcement using Kotpa because there are flying squads, and if they are going shop by shop and they find these, that enforcement can be done. Uh, Lower prices fuel consumer demand, definitely. Curtail availability through sustained market action. We must go for frequent seizures and target repeat offenders. We should adopt uniform national enforcement standards across the state. And Kotwa we can use as a first line legal tool for point of sale because there are no track and trace system. The prima facie evidence, I think, whatever the specified health warnings are there as per Rule 2008 of Section 7 of Kotpa. If there are no Indian health warnings, in prima facie we find that it is a illicit trade and it is coming from other country. So my takeaways for to the global audience is that illicit tobacco can be curtailed at retail level by enforcing mandatory pack compliance, even in the absence of a dedicated anti-smuggling law. Country-specific health warnings provide a clear, low-cost indicator of illicit trade, eliminating the need for complex tax or custom verification. Routine market surveillance backed by interdepartmental enforcement and prosecution creates edible deterrence even without a national track and trace system. So thank you very much. Thank you for your patient listening.
Thank you, Ravinder. Actually, we were together for two short-term courses in John Hopkins School of Public Health and San Francisco also regarding tobacco industry documents, how to assess them. So thank you, Ravinder. And he has been in tobacco control since long. For a small period, he was into tuberculosis program, that NTCP, that is RNTCP, or the tobacco elimination program, or the TB elimination program also. But now he's back in tobacco control, and we also uh, expect that he will be doing good work in tobacco control as always. So thanks a lot, Dr. Vinder, for sharing your good practices in Himachal Pradesh. And you also shared some of the products which have been seized by Himachal Pradesh. And Himachal Pradesh was one of the first conviction in the country on violation of Section 7 of Kotpa was there. That was way back in 2013-14. And you also have district flying squads under Kotpa. And you also shared some of the incidences of Sundarnagar, Himachal Pradesh, of the raids and the Mandi raids too. So, and you also told that how you converge with other departments like state excise and taxation, the police department, food and drug administration to control this illicit trade. And you also shared the issues and challenges and the possible solutions. So, possible solutions are that how to control that porous borders and weak upstream control and low and lower the prices, price fuels consumer demand. So you also shared some of the possible solutions to the problem. So thanks a lot, Dr. Vida. But you never touched about that how you are dealing with the tobacco cessation part in Himachal Pradesh, because tobacco cessation is very important for controlling illicit trade. In fact, nobody touched upon it. I request Dr. Rana to please touch upon this issue also. Yeah. Thank you.
Thank you, sir. for giving the talk. I would now like to invite our chief guest to please give the concluding remarks. Our chief guest is Dr. Rana Singh. He's the director at Tobacco Control Southeast Asia in Vital Strategies. So over to you for your concluding remarks.
Yes, thank you. So am I audible?
Yes, sir.
Yes,
Loud
you
and
are.
clear.
Okay. So thank you. First of all, to tobacco control section of the union and all the team members led by Dr. Rakesh Gupta ji for organizing this very, very important discussion or webinar on illicit tobacco trade in South Asia, and what are its economic and public health challenges. So good afternoon, all of you. Our very, very respected subject matter experts, Dr. Pritam Datta, Dr. Ravinder Kumar, Dr. Shafiun from Bangladesh, Dr. Tara Singh Bam from Nepal, Timor-Leste, Indonesia, Singapore, and Dr. Waseem, and many other stalwarts who are working in tobacco control in these countries and participants. So good afternoon once again. You see, we have now already heard from the experts some country experiences from our region. Overall, the purpose of this webinar is to understand, I always feel, because they did share the country experiences, but what we need to know is what, why, how, and who of illicit trade. So what is illicit trade? So it's very, very important to understand why illicit trade happens. How it happens. So this is very, very important to understand how it can be controlled and how we need to tackle it. What is the mechanism to control it, and who are responsible? Who are responsible for illicit trade, and who are also responsible to control it? And what are its implications on tobacco control? So I think these are the overall questions which we need to answer in this discussion. And I think a lot of things have already been covered by the experts. Key drivers. So this is something which is very, very important to understand. So Dr. Rakesh Gupta ji in the beginning mentioned about some key drivers like high taxes, graphical warnings. So whether they are really key drivers. So basically these are tobacco industry driven agenda or tobacco industry driven excuses which are given. Illicit trade in tobacco basically it's really very, very complex. It's a complex mix of many things. Maybe it is governance. Very, very, very important part is failure of maybe systems. It may be part of organized crime, involvement of organized crime. It may be it's a continuous supply from both legal and illegal manufacturer, and all the presentation. I think Dr. Waseem as a presentation, I think there were many excellent things which were highlighted. So it is really something very, very complex situation, contrary to the industry claims, which often says high taxes are responsible. No, high taxes are not the primary driver. Rather, non-price factors such as exemptions, low taxes, corruption, weak law enforcement play a more significant role in illicit trade. Thereafter, the experts also highlighted some porous borders, the use of free trade zones for repackaging, and a lack of effective trade track and tracing mechanism system There are other drivers which facilitate movement of illegal products. So now whom to, otherwise it was very clear, but I again want to emphasize that it is not something which is very, very recent. A study by Cancer Research UK way back in 2010, 11, 12, they made it clear that it is tobacco industry which pushes for illegal trade for or smuggling of cigarettes. While they manufacture legal cigarettes, they also push a lot of illicit trade to hook people in this direction. So why they do that? So few things have already been mentioned that they want to raise. Why their figures of the extent of illicit trade, they are higher than the actual independent studies, because they want to blame the government that your strong tobacco control policies, like graphical health warnings, like higher tobacco taxes, they are responsible. They lead to illicit trade. They lead to it because the laws are very stringent. It is difficult to enforce them. So it is why. But at the same time, they also want that by pushing cheaper products, they also want to hook people on this addiction. So these are the major reasons. I won't go into various implications, but definitely they are very, very important. First of all, it's a global problem. Really something which is contributing to the spread of tobacco epidemic. For us, who are all working in tobacco control, so illicit trade is pushing spreading the tobacco epidemic with serious consequences for public health. So it also undermines our policies like price and tax measures which are introduced for tobacco control, graphical health warning. So this is another implication. It increases the accessibility and affordability of tobacco products. You see, many brands have already been shared. There is a higher prevalence. So it leads to higher prevalence of tobacco use when there is greater availability and accessibility. And definitely I was thinking that what is the impact of illicit trade on tobacco cessation? So definitely, because it increases availability and accessibility, products are cheaper. So definitely, this is one factor which also impacts all the tobacco cessation efforts, which are being undertaken if tobacco products are freely available. But definitely, this is one area which requires further studies. So, what is the impact of illicit trade on tobacco cessation efforts? So this needs to be, I think, studied further. Economic loss to the economies, to the countries is another impact. Then adverse impact on population, especially young people, the poor, and other vulnerable groups. So these are a few implications of illicit trade. So this is something which we need to understand. All the program managers, all the people who are working as advocates for tobacco control. So we must be aware of all those tobacco industry designs. And what are the actual reasons? Tobacco tax is not the actual reason. Graphical health warning is not the reason of illicit trade. Strong enforcement is not the illicit is the reason for illicit trade. So these are the things which we should be very clear. Then what are the global efforts which have been made? So we are all aware of, first of all, it all started with FCTC, Framework Convention on Tobacco Control. There were provisions introduced under various articles. Dr. Ravinder did touch FCTC. But finally, when we started working on all those different articles, then we came up with the protocol to eliminate illicit trade in tobacco, which was adopted in 2012. And then in 2018, I think it was in September 2018, 40 parties, 40 countries, they legally they ratified. It became legally binding and came into force. This protocol to eliminate illicit trade. So this is very comprehensive. It touches upon all the gaps which experts have already mentioned, like supply chain measures, which is related to restriction on manufacturing, registering every product, keeping a track of every product which is being manufactured by even by the legal manufacturers, then manufacturing equipments, then import, export. And then another important aspect which is now emerging in many countries, and especially in countries of our region, is tobacco vendor licensing. So tobacco vendor licensing is very important aspect. So all countries, it is one of the recommendation that when we are working on illicit trade protocol, it's something that all countries should have strong policies related to trade of retail of tobacco products. So India, Bangladesh, Pakistan, they already have such laws in one or the other form. So this is important that country should work, that tobacco should not be sold by anyone. This is perhaps most common commodity we have in India. We have done many surveys in many cities, and the vendor density, tobacco vendor density is very high in many cities. City of Ranchi, almost 67 vendors per square kilometer. City of Siliguri, again about 90 vendors per square kilometer. In many cities, so vendor density is very high. Within 1 square kilometer, we find so many people who are selling tobacco. So I think this is one important area. Then establishing an international tracking and trace system. I am aware it is it requires strong digital support also. So this is an important aspect of illicit trade protocol. Then countering illicit trade through law enforcement measures. Whatever the laws countries have, they should be strongly implemented. So this is a part of illicit trade protocol. Those countries which do not have laws, they should have such laws based on FCTC and WHO empower. And then international cooperation is very, very important. All the experts have already mentioned about border issues. So international cooperation is very important, that no such products are pushed into other countries. So this is very, very important. So what is the current status? So by September 2025, 71 countries have already ratified the protocol. In our region, we are definitely again lacking. It was Sri Lanka, which was the first country to ratify illicit trade protocol. I think it was in 2016, then India, and then Pakistan. So these are the three countries in our region which has, I think, ratified protocol as per WHO information. So many countries. Why most of the countries have not been able to ratify illicit trade protocol? What are the challenges? You see, when FCTC came, many countries, perhaps the fastest treaty adopted by globally ever. But why there are challenges to now? It is almost now 13 years. It was adopted in 2012, and now it is 2026. So almost 13 years completed. So still, why most of the countries have in our region, or maybe globally, only 71 countries have not been able to ratify. There are many reasons which are being cited by the countries. For example, in Thailand, which has a excellent, which has a good history of tobacco control. It has in our region, it has something country has done a lot of good work in tobacco control. But as far as signing or ratifying ITP, so we have existing. So Thailand, as far as their concern is that we have existing strong tobacco control laws as per FCTC, and they feel that ITP is industry influence. Illicit trade protocol has been influenced by industry, and it has many loopholes. For example, they say that in Thailand we have banned ends and vape versus regulations which are promoted in illicit trade protocol. So I think similar reasons are being forwarded later to other countries in our region. Major reasons are that for signing or ratifying illicit trade protocol, countries will have to bring some new laws. It will have to change some existing laws, modify some existing laws. It will. There are many existing treaties and agreements. There are limited political commitment, tobacco industry interference, difficulty in introducing new technologies for track and trace. So these are a few reasons why ITP has illicit trade protocol has not been signed by many countries still after 13 years being into force, being adopted. So most of our discussion right now is on cigarette, but all our region, especially all of you are aware, both India, Bangladesh, Pakistan, Nepal, Myanmar, so many, so smokeless tobacco and BD, they are also major tobacco products. So there are limited evidences as far as extent of illicit trade in these countries is concerned. Independent study on smokeless tobacco, maybe there are few estimates that in India, perhaps it is about 3 to 4%, which is due to informal production. Maybe there is a tax, some kind of tax evasions. Similarly for BD, now you saw BD is most common smoking form in our country, but predominantly it is an unorganized informal sector, cottage industry, with much of production happening in household settings. So manufacturers, they operate without proper registration to evade taxes and bypass regulations. So exact estimates are really not known. And both these products are most commonly used products in our region, smokeless tobacco and BD. So there are still many challenges. More evidences are required. Independent studies are required, and all our program managers and tobacco control experts, they must be aware of this aspect of tobacco control also. Normally, we do understand smoke-free, graphical health warning, taps, tobacco advertisement, promotion, sponsorship about tobacco taxes, but illicit trade, this is another important aspect which all of us must know and act wherever now required to file. So enforcement is very crucial. In our region, Dr. Ravinder has already mentioned. So that was something which we started way back, almost 15 years, collecting all those products. And they are not, it is not very new thing. David of Mond, there is a Mond, trade name is Mond, which comes from UAE. Then ESSE, which comes from South Korea. Then there is a cookery brand. So it's almost, the pictures shown by Dr. Ravinder, almost they are 12 or 13 or 15 years old when they were when we started getting that information. Then Black, most common perhaps right now, very important brand available in our country, which comes from Indonesia. Then Gudang Garam, which comes from Indonesia. Other brands like Paris, Manchester. So there are all many such products which are available. So this is all at this stage. I hope that the organizer will develop some kind of recommendation. Yeah. What kind of more evidences needs to be generated? how we need to build the capacity of our enforcement agencies and tobacco control experts, and how to help countries. Can we have one make master document which help countries? For example, if Bangladesh or if maybe other country, Myanmar, if they want to see what are the requisites for ITP, signing ITP, illicit trade protocol, what are the things they need to do in their country, and once they are ready, so they can ratify the illicit trade protocol. So I think this kind of sport, technical sport, is definitely required. But I am really very, very happy that all the presentations done from the countries, Bangladesh, then from India, from Timor-Leste, Dr. Tara Singh, who is stalwart and does things himself, and Dr. Ravinder from Himachal Pradesh. So I think all those are practical experience. You see, this is something which they have done. And from Dr. Waseem from Pakistan. So really very, very happy. And thanks to Sipher and ECO. And over to you, Dr. Rakesh Gupta ji. Thank you very much.
So thanks a lot, Dr. Rana, for very ably, summarizing all the findings. So over to Dr. Paridhi, please.
Thank
We
you.
need to be quick.
Yeah. Thank
What
you.
is left? Yeah.
Yeah, thank you, sir, for giving the concluding remarks. I would now like to invite Dr. Aastha to moderate the question answer section.
Thank you, Dr. Paridhi. We have a few public health experts joining us today. Just a quick round of comments from them. The first is from Ms. Suzanne. She heads Faith Foundation from Gujarat. Suzanne, over to you. Just a quick comment about illicit trade and how you are tackling it in Gujarat.
I'm very unsure of the camera, so I'm just going to comment. So what we've done in Gujarat is since Patha implementation in 2019, we've been able to seize about more than 70 crores of e-cigarettes, which we have been trafficked or illicit traded through port areas, and also through the special operation groups of the police department. Of late, we could also seize e-cigarettes worth about 3 lakhs in Vadodara city itself in Gujarat. So we've seen this increasing trend in 2019-20, but now.
Thank you, Susan. Thank you.
Yeah, thank you.
Okay. Thank you so much. Thank you.
Thanks.
We also have one question from Dr. Aruna. Ma'am, are you with us? Dr. Aruna. We also have few comments from Dr.
Please
Rakesh.
unmute. Please unmute yourself, please.
Yeah, thanks a lot, sir. Thanks for sharing the valuable experience related to the illicit tobacco trade. So, I have one question. Do the cannabis is prohibited? So, just like the use of tobacco and the cannabis, most of them they use as a co-substance. So, do the illicit tobacco coexist with the cannabis as well?
Yes, who will be answering? Dr. Rana, can you answer the question?
No, I don't have any answer to this question. Maybe other experts, Dr. Waseem, Dr. Rakesh Gupta ji.
Yeah, Dr. Rakesh Gupta, I think he can comment on this issue.
Dr. Rakesh Gupta, President, Rajasthan Cancer Foundation. I guess he's left, sir.
Yeah, he's left.
Dr. Waseem, any other expert?
Yes. As such, we could not compare these two products because tobacco is sold or cigarettes are sold legally.
Yeah.
They're permissible. And in certain jurisdictions, I don't know, I'm not sure about other countries, but in Pakistan, cannabis is not allowed. It's banned. So,
Dr. Aruna, I think this question is not for this webinar, for this consultation. Yeah.
Yeah.
It is related to your expertise. I agree. Yeah.
My answer would be that in case of Pakistan, I don't find any relationship in these two because
Yeah,
tobacco sale is allowed, whereas cannabis is not allowed.
yeah,
So
agreed.
if both of them are being sold, of course they are being sold illegally.
Hmm.
Yeah, that's
Illicit
true.
products, especially in
Illicit somewhere.
Yeah, thank you.
Thanks, sir.
Thank you.
We also have with us Dr. Ramesh Gandhi. Is he there? Sir, any quick comment? Dr. Manjeet Kaur has also put a comment. Ma'am, can you just unmute yourself and tell your comment, please, if you are there?
But you need to be short. Very quick. Dr. Manjeet?
I just wanted to say that the presentations were very good, but they were all at the macro level. And if this issue has to be taken up, if it is taken up at the micro level, it may be different in different tourist areas and different cities, urban and rural areas, maybe a little different, and formal and informal sector also. For example, when I have worked with some construction workers, I've seen that they eat or they want to smoke bidi because they do not have any fixed time for lunch and they want to put in more hours of work because they get paid more. So as a result, there are no fixed hours. So that is why they all have to have this because they feel कि वो उनकी भूख को खत्म करता है. So I feel that these kind of micro level studies also would also bring out first the reasons, and there is a demand. That is why there is illicit trade. So all those things also have to be incorporated when we suggest the recommendations and studies. So thank you so much.
So Dr. Manjeet was
Thank you.
called, she's an eminent educationist. So she has got some independent views. I mean, not unlike public health specialists. So thanks a lot, Dr. Manjeet.
Thank you. Thank you so much.
Yeah, Mr.
Sir, there
Sani
are-
also there? Mr. Sani, do you have any comments? Okay, I think you can just proceed with the formal vote of thanks, Dr. Preeti. So thank you, Dr. Aastha.
Thank you so much, sir.
Thank you so much, ma'am, for moderating the question answer section. I would like to thank all our esteemed speakers. Thank you so very much for giving the talk on your respective countries. To our chief guest, Dr. Rana Singh, thank you, sir, for giving your key address. And last but not least, thank you to all the participants who joined today, taking out their valuable time to join and put the questions. So thank you very much. Dr. Rakesh, sir, anything from your side?
Yeah, thank you. Thanks a lot. Thank
All
you.
right, thank
So,
you.
did you record the session?
Yes, I did. I did.
You did. Okay,
Yeah.
okay. Thank you. So, thanks a lot. Thank you.
Thank you.
Thank you, Ji. Thank you, sir. Thank you very much.
Thank you, sir. Thank you very much.
Thank you.
I'll be closing the
Thank you.
session.
Thank you,
Thank
madam.
you.